Nu ska vi vända oss till vårt östra grannland Finland. Där har man sedan 10 år tillbaka ett nationellt allergiprogram som har gett mycket goda resultat. Vi ska få lyssna på professor Tari Haatela som har varit med under hela den här resan. Han kommer att tala till oss på engelska, men ni kommer också att få en översättning. Varsågod professor Tari Haatela.
Oh, hello everyone. I am Tari Haatela from Helsinki. I was responsible for the Finnish allergy program 2008-2018, and the idea was to improve the treatment of allergy and asthma, but most importantly, take steps from treatment to prevention to reduce the burden of these conditions in long term. It was based on the new information was based on the so-called Karelia study, where we observed that the contrast between the Finnish and the Russian Karelia is really surprising, so that there are a lot more allergies on the Finnish side, which is not explained by genetics, which is not explained by chemicalization or air pollution, but what is explained by changes in environment and lifestyle. And here on the right figure on this slide, you see how on the Finnish side there is almost a linear increase in the sensitization rate to pollens, in this case of perch pollen, on the Finnish side, when nothing seems to happen on the Russian side, when we look at the adult cohort starting from 1940s to 1980s. So if we would understand what really is the reason behind these different developments, we could take the step from treatment to prevention. And what we did then, we also created a so-called biodiversity hypothesis, because we explored the microbiome and the genetic expression in the blood white cells. And very simply, contact with natural environments enriches the microbiome, promotes immune balance, and protects from allergy and inflammatory disorders. And so we turned around the old paradigm of allergy from avoidance more to the tolerance or so-called resilience. And then focus on the more severe clinical manifestations. Here you see then a few slides about the action plan. So what are the practical steps to start? Define the community to which the program should be addressed, organize a consensus meeting, set a steering group of experts and opinion leaders, and apply funding, and then start the campaign. Then set up key messages for all citizens. In our case, strengthen tolerance, resilience, and understand that in these conditions like allergy and asthma and also other non-communicable diseases, it's not so much question of new risk factors, but losing protective factors. And they are derived from soil, natural waters, from air, from our evolutionary home, the natural environment. And we also decided to endorse health. We will start to speak about allergy health, and not so much of allergy itself, but of course we should support allergy patients and their families. Then set up goals for healthcare. The messages were for all citizens, but for healthcare, and definite and numerical quantitative goals for prevention, improving the tolerance, for diagnostics, for work-related allergies, severe conditions, and also costs. Each goal, each quantitative numerical goal had also its specific tasks tools, and evaluation methods. And here you see, for example, the goal to focus on severe asthma. There are the tasks, tools, and measures. And the steering group was planning all this to make it very precise and easy to follow. Then set a plan for an educational process. The most important issue is the educational healthcare professional. It's the key for success. And what is important is that the education should be integrated to everyday work of the professionals, so without any real extra costs. And then an information campaign was put up as well by the patient organizations in Finland, and that is for lay public and using the social media as ever before. Then you don't have to invent everything kind of thinking that, well, what should we do to follow up all this data, what is coming now? You have all the registers. You have the registers in public healthcare. You can follow the emergency visits, hospitalization, drug use, days of work, pensions, cost estimates, and so forth. So you just decide what kind of a data you are exploring and using for your follow-up to make a systematic follow-up. Then set that up, the timelines, and the two keywords are to motivate first, but with the motivation is not enough if you are not organizing the program, but organizing the program is not succeeding without motivation. So motivate and organize. Here, a very simple outline, a generic template of the program. Here on the left, the goals, the tasks, tools, and outcomes, the main messages for the lay public. And here we are. And now we are ready also the results, the 10-year results. I'm not going to any detail, but here you see that in most outcomes we have really been very successful. And just to say something about money, that if you compare the years 2007 and 2018, there was a saving of 200 million euros, which is 30%. And when the indicator of success was put there when at the beginning, 20%. So we were quite successful. And if you look the cumulative saving over the 10 years, it's 1.2 billion. You can scale that up at the European level. So thank you very much, my dear friends, ladies and gentlemen, and all those who are taking care of allergic people in Sweden. Take a nature step to health, and we have a good model in Finland, and we are ready to contribute and help you wherever and whenever you need. Thank you.
Thank you, Professor Tari Haatela. Nya rön om toleransutveckling öppnade dörren till allergiprogrammet i Finland. Och frågan är, vad ville man uppnå och hur ser resultaten ut 10 år senare? And now we have to switch to English when we talk to Professor Mika Mäkelä in Finland. Welcome, Professor Mäkelä. We look forward to listening to you about the Finnish experiences and how you have been running a successful national allergy program for 10 years. Please, the stage is yours.
Tusen tack, Göran. Hjärtligt tack för inbjudan. Jag vill gratulera er alla. Ni har nästan 1000 lyssnare nu, så det är fantastiskt att ha det här dagen, och jag önskar allt bästa för vad det ska göra i framtiden. But now I'm switching to English and going to talk a little bit about, let's see, okay. little bit about the stuff what we have been doing and how it affected the society. When we started, like Tari was saying, we set the goals and we set the program measures and so on, but we also wanted to write kind of a basis of why we are doing this. And the whole basis of the idea of the program was that the current allergen avoidance has not proved effective in halting the allergy epidemic, and it is the Finnish consensus that restoring and strengthening tolerance should be more in focus. And this is, I think, the key of the program. We had tried every possible way to avoid allergens, to have really a lot of restrictions in the lives of allergic people and so on, and nothing seemed to work. All the numbers were going up. Basically half the population is allergic. So we felt that something is wrong, and new science started coming up, which showed that probably we were mostly wrong, partly right. So we started doing the changes, and we have been lucky to have guidelines in a lot of diseases in Finland. This was started from our medical society, Duodeckim, already in end of 90s. So we have been doing current care guidelines for more than 100 different diseases and disease entities. And we had already asthma. We started doing the food allergy guidelines during the program. Same thing with atopic dermatitis. And then allergen-specific immunotherapy was started just before the program, and so on. And so we have others which are somehow linked to these subjects what we are talking here. For some concrete recommendations we give, and when we started giving, mind you, in 2008 already. At that time, it was still not very clear how to start the solids and so on. So we started saying that the window is somewhere between 4 to 6 months of age. During the program, there has been a lot of new data coming out, and in the States, for example, they have started food introduction clinics and so on. We have absolutely not seen any basis for that, and we are not doing those. We don't put breastfeeding mothers on diets. We are really focusing on everyone, not only small children, that avoid only those allergens that cause objectively shown symptoms. And I think that the Queen this morning said something extremely important. Don't forget adults. I think this is not the disease only for small children. This is for the whole population, and you have to include the adult doctors and adult patients very strongly, and adult nurses, everything. So this is this allergen avoidance. I'm seeing myself also allergy patients when they are adult, and it's very common to have these wrong concepts and so on. So that's why I'm emphasizing this one. Then there were things what allergists loved, like having an animal in when the baby is small. Does it matter or not? I don't think it matters, and this is more like what we say to the public. Then there were a lot of allergy diets. We had schools where 30% of kids were on special allergy diets, which were hugely costly. And we started saying that no, you cannot anymore choose yourself your allergy diets. It has to be based on diagnostics, on doctor statements and objective diagnostics. So what we have seen during the program, we have been looking carefully all the time also, are we doing any harm? Of course, the moral and the ethics says that we have to do only good. We can't do any bad. And this has been, of course, the dilemma that some hardcore people, and we are going to talk soon about that, fear that we are doing some harm if we are saying too harshly things and so on. So we have been looking at anaphylaxis reactions, for example. And Juho Kivistö, I actually more or less sent him to one of your day speakers, Magnus Wikman's group, and he worked there a long time looking at the Finnish and Swedish data and comparing them. And this is, for example, the anaphylaxis reactions and hospitalizations of those in Sweden and Finland during the program time. So as you can see, we are not doing very badly.
We have an allergy registry, which is, of course, based on free will. So doctors are reporting those, but we are getting roughly 100 reports per year. And we have been comparing those to the European anaphylaxis registries, and we are seeing very similar results and nothing that would cause any extra worries. We have been looking at anaphylaxis deaths. They have been quite stable, although the number of anaphylaxis cases is going all the time up mildly. We don't see an increase in anaphylaxis deaths, and we were very, very happy to see with Juho when we did this material through registries that we didn't have a single pediatric death during the 17 years we were able to look. Juho has also been doing with Jennifer Protruder analysis on asthma deaths, and it's extremely low. For example, 4 Finnish children died from asthma between 1999 and 2015. So it's really rare to have this. I know one of those, for example, was during the swine flu epidemic, a small kid who basically died of the swine flu more than asthma, but anyway, it was listed as an asthma death. Asthma hospitalizations have been also going down all the time during the program, although we have been saying that don't use overly excessively inhaled corticosteroids, don't start them on a week basis for small children, don't over-diagnose asthma and all this. Despite of this, we are seeing decrease in actually ER visits and in the number of hospitalizations. And finally, and something that we feel is very important, we have a very secure system, so to say, to diagnose milk allergy. This is because we are getting reimbursement from the National Social Insurance Institution, and the diagnosis has been made the same way for more than 15 years. You can either get compensated to normal formula for milk allergic babies, or specially extensively hydrolyzed cow's milk formula. So there are 2 diagnosis codes. But if you look at the numbers here, we were very stable with 2,500 diagnoses per year, and now we have actually decreased almost 60% of those diagnoses. And everyone in Finland, around Finland, and all the polyclinics and pediatric polyclinics are saying the same thing. We have less and less milk allergic kids coming to the departments and having the challenges. So some points that we have learned. First of all, we emphasize always that this is rather a campaign than a study. People tend to think that we would have some data which would be from controlled randomized trials, but those are completely different things. This is a campaign. But we have been able to measure the changes, and they are, to some extent at least, measurable. Allergies are common enough to be seen. We need strategies to reduce the total burden. We have to focus on the severe patients so that we put resources on those, but there are so many of those with very mild symptoms that we have to just give simple instructions for them and give the well baby clinics and so on, the healthcare centers, some simple kind of guidelines how to take care of the very mild cases. We need clinical science and information from there for education and for creating inspiration. For example, I started as the first one in Scandinavia, the oral immunotherapy trials in 2005 with milk desensitization. And every time we started a trial, it got very much attention from the public, and we were in the newspapers with those and so on. So it's helped in creating this kind of idea that we want to increase tolerance in the population with food allergies. A big part of the mass problem can be handled with good common sense, but we need the science-based guidelines and practical directions where to go. Challenges remain, of course, and it's maintaining the changes in attitudes, both with the healthcare personnel and patients. So thank you, and I'm pleased to answer your questions, Jan.
Thank you very much, Mika. Really interesting, and I think it's amazing what you have reached. As you mentioned in the end, one thing is getting results from research, and another thing is to implement the research result in the actual healthcare or childcare. How have you managed to get the professionals supporting you in this transition?
Well, actually, I think we have been lucky to have this both sides. There are a lot of allergists and healthcare doctors and so on who are actually waiting for this data also in their hands, and they are really willing to implement it. A lot of these doctors and nurses and so on have felt that the changes what we have made their work easier, that they have more clear messages to their patients, and they have to hassle less with patients because of this. And they feel that they get good communication tools for the patients through the science as well.
Good. And when it comes to the economic consequences, have it been expensive to run this new program in Finland?
No, I mean, we have done it mostly based on just people taking with their present job responsibilities and giving lectures, doing the education, participating in research, and so on. So the total cost what we have put in the program is really it's amazingly low. It's a few hundreds of thousands euros, so that would be a few millions of Swedish crowns altogether during the 10-year program.
And on the positive side, what can you say about the economic consequences on the positive side? Have it been possible to measure the wins, so to say, from this new program?
Yeah, we have even published in Finnish Medical Journal some of the results. We have seen indirect costs if you take both asthma and allergies. We have seen indirect costs about 10% decrease altogether. Whereas if you inflate it, they should have increased, of course, during the 10-year program, but there has been a 10% decrease. If you take the indirect costs, and there we come, of course, with the sick pensions and sick days and so on, then we would be looking at a total cost saving of 30%. I mean, what Tari Haatela presented in his talk, of course, those are extrapolated numbers, and they are based on, in asthma, for example, they're based that all the patients would have been as severe like they used to be in the 90s and so on. So the billions, I'm not quite convinced that myself that it would be in billions, the savings. But anyway, we are seeing through decrease rather than increase, with like in most diseases all the time.
Very good. I have a last question. It's from the chat. Someone is Sara. She's asking about the experience from the patient's points of view. What does the patient say? Have they learned to tolerate the new situation and doesn't have symptoms anymore, or do they have to live with symptoms and get treatment through pharmaceuticals? Do you understand the question?
Yes, I understand it. I would say that majority of patients have taken this extremely well. And self-treatment, for example, if for mild hay fever, people are doing a lot of that. They don't necessarily go to the doctor for that and so on. With mild symptoms, when they have small children, for example, with food allergies, they learn to avoid the level of avoidance themselves nowadays with the guidance of also well baby clinics and so on. So I would say that by far the majority has been taking it very, very well, and they feel also often relieved that they don't need to be afraid of the disease, that it's not going to get much more severe. For example, let's take a simple message that when you have itching of mouth because of apple, when you have birch allergy, when you tell them that it's not going to become anaphylaxis. It stays the same, and you can check yourself whether you get symptoms during the winter. If not, use your apples. If you only get symptoms in May, forget about the apples in May, but use them otherwise, and so on. So simple things, and they like it. But mind you, of course, there are always those single patients who are extra cautious. There are in every single clinic, there are those extra cautious patients who are also afraid that they are being left alone, and are they not being taken seriously, and so on. So these are the messages that you, of course, have to keep all the time very, very actively open, and you have to discuss, and you can't diminish people's symptoms or troubles. You have to listen to everyone. And this is the message I'm saying to you.
Very good. Then we would like to thank you, Professor Mika Mäkelä. It has been most useful, and I think we will be a very good foundation for the discussion to come during the day. Thank you very much for your part here. Thank you.
Thank you very much, and good luck.
Thank you.